COVID-19 related hospitalizations in the U.S. are on the rise again. In the last 2 weeks, the number of people hospitalized with COVID rose by more than 12%. And according to the Centers for Disease Control and Prevention, over 9,000 people were admitted with the virus, representing a 12.5% uptick.
24 states saw a 12% increase, while several others, including Maryland, Alabama, Alaska, Florida, to name just a few, saw more than a 20% jump. Now, New Hampshire had the biggest leap, with hospitalizations jumping 96% in a single week. Meanwhile, North Dakota, Minnesota, and Arizona experienced the least number of COVID-related admissions. Now, those percentages, as we were saying before we started the segment, can be
affected by the original number
a
of
96%
infections.
Jump could be, there could be a very small number of hospitalizations that, you know, goes up from like 5 to 10
in a state like New Hampshire that's both rural and low population, I would expect that you had, let's say, 4 infections that became 8. I'm making up numbers here, but you know that could be the case there. But in some of these more densely populated states that are also, you know, more urban states where you expect there have always throughout the pandemic been higher infection rates. I wonder if there is going to be the same kind of cause for concern to see rates rising if there has been, it seems, a public acceptance of COVID as a reality of life, and combined with people having already contracted COVID, it does feel like there's a diminished fear of the virus, which might be a good thing in some respects, but also might be a bad thing if long COVID, in fact, is something that's going to continue to haunt us from a medical perspective for years to come.
We've had, every year of the pandemic, we have had an increase in many states around now because people are just, you know, socializing more during the summer. A lot of that socializing is outdoors, but it's in some states it's actually very hot out, so you go inside and where there's air conditioning. So many states have seen increases around now every year. And I think people have just gotten used to it. People have, I don't know what the statistic is now, but I think it's estimated that upwards of like 90% or more of all people in the United States have had COVID at least once by now. Many of them, our vaccination rate was something like 2/3, at least, more than that, maybe well more than that. So virtually all Americans have some level of protection from COVID, either from a prior infection or from a vaccine or booster or both. And I think that's just, you know, it is now just the flu for most people. And the flu can be dangerous. It hospitalizes people every year. It kills some people. But that's just kind of how we're treating it now, I think. But
the flu is a good example because there is a public health response to the flu that anticipates that hospitals can become overburdened if a flu epidemic one year is bigger than average. The government encourages people to get flu vaccines, makes them available, things like that, CVS and whatnot. I wonder if that kind of approach to COVID going forward, that treats it as something less than a pandemic, but akin to how the government has a response to the flu, would be well received, given that there are still so many people who bristle at the government's approach to COVID the first time around. Would they be willing to accept encouragement to, let's say, get a booster or mask in certain circumstances to help keep the hospital patient load down when there are spikes like this that could put a strain on the healthcare system? Or does that even seem too draconian, given the people's fears that they will be in a world of mandates and the like that they were in before?
Right. Look, as long as it's voluntary, I don't really care. If the CDC, the government health officials, want to give recommendations and they're really just recommendations, like, we think you ought to do this would be good for you, then I don't care. If other people want to wear masks, that's fine. If people want to test regularly, that's fine.
Robby, could you really think it's fine? You think it's that people don't have an issue with voluntary mask wearing or these other kind of voluntary COVID prevention mechanisms when there is so much mirth and ire directed toward people who do mask to this day? We were just having a joking conversation about what it means, the public the social implications of someone being out and about masking these days. And I feel it when I mask, when I was masking on a plane recently, that there's a weird opposite negative pressure to not do so, because I think it reminds people that, you know, some of us still don't want to catch COVID, precisely because evidence shows that the more times you catch COVID, the more likely you are to contract long COVID.
I want to come back to the long COVID in a minute. Sure. But look, I've never shamed at or sneered at to their face anyone wearing a mask under any circumstance. I have been shamed or attacked by people who are wearing masks for not wearing one. So that's the only way this has ever gone.
Robby?
It's been it's a long time. That doesn't happen too much anymore,
Well,
but I don't think it's happening.
I'm talking about what's
way.
happening now. As someone who still wears masks in airports and public places, you know, I do feel like there is, you know, a negative shaming. And this is not to say a tit for tat and you do it and I do it and da-da-da-da. It's just to say that I do think that we should be a little less flippant about the idea that as long as everything's voluntary, everything's fine. Because whether rightly or wrongly, I think people's resentment for how they were treated in an earlier phase of the pandemic has trickled over, and people who are continuing to mask, I think, are characterized as virtue signaling and doing something that is not actually well tailored to actually having any medical outcomes, any preventative outcomes, and are sneered at as a consequence of that. But you wanted to come back to the long COVID point.
Sure. You seem more worried than I am about the possibility of long COVID. I know there are a lot of people on the left. Well, it seems like a split because there are some left people who think it's not a big deal, but some on the left seem very concerned about it. I have my skepticisms of a lot of the mainstream narratives surrounding long COVID, but you think it's something to be very wary of?
Well, I know that we live in a country that has a history of not providing health care for its citizens, of externalizing the costs of public health issues to individuals, many of whom don't have the means to pay for care, especially long-term care. Something that RFK Jr. has gotten a lot of accolades for talking about is chronic illness and the burden of chronic illness on families from a financial perspective, as well as obviously just a personal health perspective and mental health perspective. And I would not be surprised in the least if there's a bipartisan consensus on downplaying the long-term effects of long COVID because the U.S. health system simply doesn't want to be responsible for it.
Most of the people I see on social media talking about long COVID are activists on behalf of long COVID who seem to desperately want the return of mandates, not just COVID wariness, but masking requirements, maybe even more lockdowns, those kinds of things. So it seems like it's being wielded as a pretext to bring back very bad policies.
I don't know. I haven't seen it that way. I've seen a lot of people with long COVID. I know people who I trust and are friends and are not drama queens or kings who say that they have long COVID and have been experiencing symptoms. People who very much need their jobs and need to work and haven't been able to do so, who are living in precarity as a consequence of it. And it's worth noting, you know, do you really think that everybody is lying when, according to a recent survey from June, more than 40% of the adults in the United States reported having COVID in the past, and nearly 1 in 5 of those, 19%, say they're still currently having symptoms of long COVID. Even if half of those, and then half of that, you thought were activists or people advancing a political agenda, at a certain point, isn't there still a significant number of people who say that they're experiencing symptoms that we should be concerned about?
Well, not all. Some of those symptoms vary greatly in, well, even in what the underlying symptom is, and also in severity. Do I believe that whatever percentage you just mentioned have some ongoing respiratory issues, maybe some shortness of breath or something like that for some period of time following a bad bout with COVID? Yeah, absolutely. The severe and debilitating, like life-altering, brain fog, all these things, I have some skepticism. I mean, I remember the study from very early on in the pandemic where a large number of people who self-identified as having long COVID were tested for antibodies and had never had COVID in the first place. I've also seen statistically the people most likely to self-report debilitating long COVID are people who have higher rates of mental illness and anxiety, disproportionately women, disproportionately affluent white women, in fact, who this would be the exact population you would expect if it is some kind of mental health issue rather than an actual debilitating disease.
I don't know about that. My closest friend with long COVID is a black man. So I'm not sure about that if we're just pulling out anecdotal evidence.
No, I'm not. That's not anecdotal evidence. That's anecdotal evidence. This is statistical.
Sure. Well, the anecdotal part is saying that because white women have a disease, it's more likely to be hysteria. It's more likely to be a mental health issue as opposed to a real disease, which is statistically, not anecdotally, something that causes women to get less health care and to suffer enormously from diseases like endometriosis because their doctors don't take their health concerns seriously. But regardless, 10% of people infected by COVID, according to this study I'm looking at in Nature, 65 million individuals around the world say that they have long COVID. And if that is even a percentage of that represents people who have debilitating illnesses, and if the likelihood of getting long COVID is compounded the more times you get COVID, it does seem like at very least there needs to be a lot more study into whether or not this is something that there should be a more robust public health response to. I would hate to wake up 20 years from now and realize we have entire population of people with diminished cognitive capacity and health capacity, and we could have done something about it, and we just decided to ignore it. One other point I just wanted to make was, it does seem to me that there are a lot of people who, I think correctly, have raised questions about the health effects of vaccinations among particularly young men for whom the vaccine offers fewer protective benefits versus the potential risk of myocarditis and the like. And given the similarity of the symptoms of vaccine injury and COVID injury, long COVID, it is interesting to me that it's become polarized in this way, where conservatives are willing to talk at length about vaccine injury in a way that I think is useful and promotes good scientific research, but it seemed to be indifferent, not because of evidence, but because of politics, to even considering the possibility of long COVID.
This is our split. I'm very skeptical of a lot of the vaccine injury claims, the same way that I'm skeptical of the long COVID
but skepticism and saying that something should be further
investigated. The same way that I was
investigated.
skeptical of, for instance, Havana syndrome, which is totally fake, no matter how many people self-report it.
Well, I think there's a little bit of a difference between saying like energy waves are hurting people's brains in Cuba and saying that people who have been hospitalized from a pandemic that just recently shut down the entire world continue to have demonstrable effects, including in brain scans that show differences between brains of people who are suffering from long COVID and other people.
And the trauma of having gone through the pandemic and having lost loved ones, and the trauma from having gone through the lockdowns and even if you think they're necessary, you could recognize that maybe that was necessary, but it was still traumatizing and horrible, and that can have a lingering effect on people as well. I wonder if some of it's that.
And do you also? Okay, all right. We'll have more Rising for you right after this.